CDC now reports a 60% drop nationally in the number of new COVID cases since January 8th. And here to answer your questions is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Good to see you.
You too.
So 60%, that is a huge decline. How does Massachusetts compare right now to the rest of the country? And does the data show that COVID vaccines are starting to have an effect?
Well, over that same time period, Massachusetts data show the same dramatic decline as the rest of the country. And while we have seen a big drop in cases in hospital employees and nursing home residents where vaccination efforts have been successful, we've not yet had enough of the general public vaccinated for that 60% to be due to vaccination. So the real cause is probably multifactorial. The holidays are behind us. Maybe people are being more careful. There are even some theories that we might be starting to see an effect that comes from the sheer number of people, known and unknown, who've had COVID and are now immune. But whatever the reason, it's not time to let our guard down.
All right, good reminder. We've had some encouraging news this week about vaccines. The one from Johnson & Johnson, that's close to becoming the third vaccine authorized in the U.S. What's different about this one?
Well, the vaccine uses different technology. It's a common cold virus that can't multiply but carries the coronavirus spike protein into the cell, triggering an immune response. What's great about it is, first, it's a one-dose vaccine, and second, it only needs standard refrigeration, not an ultra-cold freezer like the Pfizer and Moderna vaccines. So a lot of the difficult logistics that we've seen so far can be eliminated if we get a decent supply of this new vaccine when it's approved, hopefully next month.
Right, and the advisory committee meets at the end of the month on that. We also got new information today about AstraZeneca, the company saying that its vaccine candidate appears to be pretty much just as effective against the UK variant as it is against the original strain. Why does that matter?
Well, we obviously all really want to know whether the current vaccine rollout is going to bring us back to normalcy and when. And that's hard to predict still, and partly that's because we have this new worry that variant strains could evade the immunity induced by new vaccines. So it appears likely that even if the B.1.1.7 strain from the UK becomes the predominant one in the US, existing vaccines will still be effective. Now, the variant from South Africa does unfortunately appear to be better at evading immunity from infection and vaccination. So we'll have to keep our eye on that one.
Governor Baker spoke today about the hesitation that some people have about getting vaccinated. So I wanted to ask you about a rumor that is spreading on social media. This rumor says that vaccines contain a microchip, a tracker of some kind that the government can access. Is this true?
Definitely not.
Okay.
Sometimes I think that misinformation spreads faster than the virus itself, and that's why I join you every Friday night to spread good, truthful science.
And that's why we love having you to debunk these things. Thank you so much once again, Dr. Doron, for being here, for your insight. We really appreciate it.
Thank you.